Hi there, my name is Dr. Jennifer Hicks, and I am providing hormone replacement therapy for our patients here at Key Laser. I've been in the field for many years. I've been getting pellets myself for, 6 years or so now. Love them, patients love them. But why do I choose pellets? That's what I want to talk about today. First of all, what are pellets? Pellets are basically these very compressed form of hormone that is a little bit bigger than a grain of rice, and they're inserted in the glute area here, under the skin, in the subcutaneous fat, and they slow release over a period of 3 to 6 months. Usually it's 3 to 5 months for women, 4 to 6 months for men, depending, on the person's metabolism, the individual metabolism of the hormones. Um, they break down slowly, so they give us a nice consistent release of hormones over that 3 to 6 month period. They also release a little bit more when your heart is beating faster, when you're exercising, when you're under stress, when you need a little bit more of the hormone around. That is what draws the hormone. The heart rate is what draws the hormone into the system. And so they kind of the best reproduce, you know, having your own ovary or testes or, produce these hormones without 3D printing your ovary and giving it back to you is the way I like to look at it. The best I can do is give you the pellet because it most closely replicates the actual production of hormone from the system uh, when it was still doing a great job producing those hormones. Uh, but let's talk about the other methods because I certainly, in very few certain select cases, recommend other forms of delivery. Um, and we'll talk about why. The first other form of delivery I want to talk about is injection therapy. You've probably heard about patients injecting testosterone. You may have injected yourself in the past. Um, my biggest issue with injections is that to really get a stable level in the blood, I need you to inject the testosterone every 3 to 4 days. And I often encounter a lot of resistance when I ask patients that they tell them they need to inject every 3 to 4 days. They don't want to poke themselves with a needle every 3 to 4 days. That's quite frequent in most patients' mind. So the pellets in those cases are just so much more convenient. Once and done, don't have to think about it again for 4 to 6 months. Um, there's also skin delivered hormones, so we can deliver hormones through creams, gels, patches, various ways to get the hormone through the skin. And I don't love these methods for a few other different reasons. Patches, a lot of women complain about rotating sites, patches falling off, not staying on. They're spendy. Pharmaceutical companies make these, and they're not super cheap, so there's a significant cost involved if you don't have great insurance. Um, and a lot of women just don't feel that they adequately correct their symptom picture. They don't get a complete relief, um, and don't love that they fall off all the time, or that they have to worry about the patch and where it is and can someone see it, and I don't want anybody to know about it. So various reasons I don't love the patches. Creams and gels, in order to get a consistent level in the blood, as far as levels go, you need to really apply those things twice a day. And twice a day application of anything is a big hassle for a lot of patients. Um, the other thing I worry about with creams and gels is the potential delivery to people and things that don't need the hormones, the transference issues. Because if someone puts on a cream on their skin and then immediately they wash their hands, but then say they hold a baby with that arm that the hormone was on, or they pet their dog, or the dog lays next to them, and then the dog licks its fur. We can deliver these skin delivered hormones to other people in our house, other animals in our house, um, without even knowing it. And I've seen dogs develop breast tissue because of their owner's estrogen that was being used on their skin, and the owner wasn't concerned or as cautious as they should have been about the transference issue. So I don't love creams or gels for that reason. Um, Another way we can deliver hormones is by oral route, by taking a pill. Pills, especially for estrogen and testosterone, come with a higher risk profile. Um, Oral testosterone has been all but taken off the market. I mean, there's a new form coming out right now that doesn't have this issue, but it was off the market for quite a while due to liver toxicity. when we take testosterone by mouth. So, of course, nobody loves that. And then estrogen by mouth potentially comes with a slightly higher risk of cardiovascular incidence. So, last recommendations that I'm following are probably best to transfer to a different form of estrogen after the age of 65. Well, if it has that risk after age 65, why use it at all, is my opinion. Why not use a safer route from the get-go? So I love pellet therapy for these reasons. I can get consistent levels in patients' bloodstream of the hormones. They're safer in a lot of cases. It's much more convenient for the patient in a lot of cases. They are 100% bioidentical, meaning they are equivalent of what the human body produces. When those hormones are equivalent to what the human body produces, it means they act on the cells of the body the same way that the hormones did when your body was producing high levels of them. So I love that, which also results in less risk, higher safety profiles. And I have a great patient satisfaction rating for pellets. I mean, in the majority of cases, people are saying, oh my gosh, I wish I would have known this was out there sooner. So I invite you to come in, get some lab work done, have a consultation with me, talk about the options for you given your history, your risk factors, your family history, your lifestyle, what's going to be best for you and most convenient for you. I happily talk about all these options with my patients, but my preferred method is the pellet. So hope you have a great day. Thanks so much.